The Director of the Africa Centers for Disease Control and Prevention, Dr. John Gengasong, has already started the briefing for the week. Let's take you there live.
Total of about 5% average decrease, 5% average decrease over the last 4 weeks. With countries like Egypt reporting an average of 15% increase, Nigeria 43% average decrease, DRC 43% average decrease, Kenya 37% average increase, South Africa 31% average decrease, and Ethiopia 25% average decrease. In terms of new deaths, we've also recorded 18% average increase, which is expected. As you see the number of new cases, even when they begin to peak, those who were infected previously, you continue to see deaths occurring there. We hope that over the next couple of weeks, you begin to see a decrease in the number of these deaths. In terms of testing, a continent, we've conducted or reported a total of 94.5 million COVID tests conducted since the start of the pandemic. With regards to vaccines, a total of 580 million COVID doses have been received on the continent. And of that number, 64% total have been administered, with about 11% of the population fully vaccinated, 11%. Egypt is reporting a 24% fully vaccinated eligible population, Morocco 62%, South Africa 27%, Mozambique 29%, and Nigeria 2.5%. 37 million doses of the AVAC vaccines have now gone to 35 member states. I think when that is all, at least for this week, let me turn it back to you for the question and answer session.
All right. Thank you very much, John. Colleagues, it is time for our question and answer section. Let me just give you the details for you to put through your questions. So you have the option to come through live on our platform, and also to utilize that WhatsApp number +251 94 550 2310. Perhaps let's start off, Dr. John, with a question about the Omicron. Many people are saying that this is the variant that will kill off COVID-19. How far true is that?
It's too early when to say whether this is going to be the variant that kills off the pandemic. But because it infects many people, and as such, it means so many people have developed immune response to it. It is hoped that it will create that barrier that we've been looking for. So I think, but it's too early. We don't have any evidence, scientific evidence to point to this. But there's a hypothesis in that direction for now. You can imagine that if the virus that spreads very quickly, but results to fewer deaths, will leave people in the general population with a high level of population immunity, which may help in decreasing the severity of any subsequent infection, leading to that population-based level of immunization that we are looking for. Again, we still have to wait on the science, full evidence to show that that is the case.
Thank you very much. We rely on the science always. All right, we have Sarah Jerving, who is with DEVEX, I believe. And Sarah, you have your hand up. Please go ahead with your question.
Thank you so much. WHO has raised concerns about syringe shortages this year needed to administer vaccines, COVID-19 vaccines. Are you concerned? And what is happening currently in countries regarding syringes? Thank you.
Yes, WHO is concerned. We are also concerned that as we ramp up and scale up vaccination, that will become an issue. And we are factoring that into our planning. That is the saving lives and Saving Livelihood initiative, you, as expected, there's an overall supply chain issue across the world due to the pandemic. So syringes and other requirements for vaccination would not be an exception.
All right, thank you.
Let me just add that we don't know yet of any country that has stopped their vaccination program because of lack of syringes, but we anticipate that it will become a problem going forward.
Okay, thank you so much. Let's now say hello to Mohamodzi Mahome, and Mohamodzi is with Associated Press and says two things actually. The first one, do you think that making rapid COVID-19 tests for self-testing and home use, making this freely available in Africa, as we have seen in the United States and in the European countries, can actually help to expand testing on the continent in order to fight the spread of the virus? So that's the first question. The second one, the WHO is yet to provide guidelines on rapid testing and self-use of these. Is this an impediment for the widespread procurement and distribution of rapid tests in Africa?
I think we should do everything possible to decentralize testing and make it push it into the community so that people can be empowered to know their status, and if they know their status, they can take action. Do that. That would be is critical that we work in that direction. We have not issued guidelines in that direction, but we've argued before the start of this year that we were working to actually expand testing. Okay, and the most we've learned from HIV, one lesson we've learned from HIV is that self-testing is so critical that if people know their status, they tend to do the right thing, especially for COVID. And that will also be a critical component for preparing for the next variant. So let's imagine a variant that is as transmissible as Omicron, but also is as deadly as Delta. So that would mean that so many people will need to go to the hospital. But if we have the ability to empower people to test and take a treatment, assuming that treatments like Paxlovid are available, then I think that is that will become a very important solution, a public health solution in blunting any wave, that potential wave due to any emerging variant. So I think we are all for decentralization, empowering of the community to do self-testing.
All right, thank you. Hilary Orinde from Agence France Presse. Hilary says, do you expect COVID-19 to be a major point of discussion at the upcoming AU summit? It has started already, actually, at the AU summit. And what issues specifically do you hope to raise? That's one point. What will be your message to heads of state and government on topics such as expanding access to vaccines and administering more vaccines? And what opportunities does the summit provide to help member states address these challenges?
So a full report on the pandemic will be presented by President Cyril Ramaphosa, who is the COVID champion for the African Union. And he's done a remarkable job when he was chair of the African Union, guiding the pandemic at the political level. He has since continued to be a COVID champion and is leading a COVID commission. And we expect that, not really expect, he will present a comprehensive report on that with emphasis on the need for the continent to rally around and support and scale up vaccination. I think that will be highlighted, and he will be calling on his peers to do anything possible so that as a continent, we can at least focus on the vaccination component of it. I think that will be a key component that will be discussed at the meeting.
All right, thank you. It's over now to James Macharia Chege at Reuters in Johannesburg. James says, in Nigeria, authorities are saying that vaccine take-up there is on the rise. Is this something that you have noticed as the Africa CDC? That's one part. The second part is, what would you attribute this rise to? And then he wonders, maybe the earlier hesitancy was due to reports of expired vaccines, and that this has waned after the vaccines were destroyed. So the second question really is, what would you attribute the rise in uptake of vaccines in Nigeria to?
So that's a very good question, James. Remember, I've always quoted these statistics that studies after studies, including those conducted by Africa's CDC, the World Bank, and a recent study published maybe in November last year, all point to the fact that on average, about 80% of the population of countries that have been studied are ready to receive vaccines. There's, of course, a 20% population out there that is hesitant to vaccines, but it's not static. Okay, each time there's noise around a vaccine, like aspiration in the media, there is noise about AstraZeneca vaccines not arriving on time. It creates some kind of hesitation in the population with respect to the ability to go out and get the vaccine. So I'm not surprised to see the uptake of Nigeria increasing. We also expect to see that across the board as the vaccines becomes available. We have a team in Cameroon as we speak, led by Dr. Mohamed Abdullahi, that is supporting the African Nation Cup. And we've also seen a very sharp increase there. Of course, that situation is unique because it's a requirement to get into the stadium out in Cameroon. So we continue to see increases in countries, and we, as more vaccines are available and we improve our community engagement and communication, we expect to see more uptake of vaccines across many countries.
Thank you, John. We go over to Kenya and say hello to Judith Akolo, who is with the Kenya Broadcasting Corporation. And Judith says, in the past week, we have seen an increased number of deaths due to COVID-19, and yet we were told that Omicron variant is mild. Could these deaths be associated with Omicron, or is it that Delta is still dominant in Kenya?
Well, again, Omicron is not, the narrative says, is not as severe as Delta, but it doesn't mean it doesn't cause deaths. I think that is just means that it's a reduced number of deaths compared to Delta. So, and until we see the data, the genomic data in Kenya, which we don't have at this point, it is difficult to know the ratio, the proportion of the Omicron versus the Delta. So I don't know if Omicron has completely taken over the infections in Kenya because we don't have that data set. But please, let's not, the narrative is not that Omicron doesn't cause death. It causes deaths, but it's much less than what the deaths we have seen due to the Delta variant.
Okay. We have someone writing from China Radio International, and he is Ronald Mutier. He has 3 questions or 4, but I'll give you the first 2 and come back to him later. So the first one is, what is your comment on the cooperation on advancing health between China and Africa? Then secondly, at this time when the world is forging ahead to get everyone vaccinated, what would you say has been the Chinese contribution and Chinese efforts for the China-Africa community of shared future?
I think the African Union has a policy of an open policy for broad collaboration with all the partners and all parties. I think as long as they respect our Agenda 2063, and Africa CDC, as you know, also has a strategic plan and a vision. The African Union also has an agenda that for our what we call a health strategy that spans from 2016 to 2030. So I think all partnerships within that framework are so much welcome. Africa CDC currently works with a whole host of partners, including China, the United States, the European Union, probably had England, et cetera, so many to name. We work with at least 50 partners. So I think in recognition that the issues that we are dealing with, including COVID, HIV, AIDS, TB, malaria, are vast across the continent. So all collaboration that leads to that shared vision, a vision that is encapsulated in the Agenda 2063, is always welcome.
All right, thank you. I noticed that the rest of Ronald's questions are not related to COVID-19. So I will move on to question coming through from Ralph Kruger, who is with the German press agency, the DPA in Johannesburg. Ralph says, with only 11% of Africa's population having been fully vaccinated, will you achieve your goal of having 70% vaccination by the end of the year?
It's a goal we are striving to get to. And as the previous colleague indicated in Nigeria, if those trends we are seeing across several countries maintain, then we remain hopeful that we should be going to that. The 2022 should be the year that we truly elevate the percentage of people vaccinated, fully vaccinated on the continent, in order to have a fighting chance of turning the page on this pandemic. So it's not, the 70% is not a wishful target. It is a programmatic target that we should all do everything, build the relationships and partnerships required, just as the ones we've developed with the MasterCard Foundation to get to that 70%.
All right, thank you. Agostino Leite, who is with the Lusa News Agency in Lisbon, in Portugal, says, what can you tell us about the treatment protocols being used, the new solutions in the near horizon, and eventually any forthcoming procurements?
So we are still working with the Pfizer folks to secure the Paxlovid drugs. We are, these discussions are not fast, but we are in the right direction. We have also now opened a communication with folks from Merck. So that discussion will guide us as to how we can also have access to the drug that they produce. I think we're open to all engaging with any company that is willing to work with us to make the drug accessible on the continent.
All right. Thank you, John. Before we move on to our next question, let me just remind colleagues of how they can ask their questions. So you can use the WhatsApp number +251 94 2310, or you can contact us either live or through the question and answer section on this platform. We move on, and it's hello again to James Macharia Chege at Reuters. And James says, Dr. Nkengasong, is there anything more that you can tell us about the discussions by African countries to buy the Merck and Pfizer pills?
So there's not much I can tell you until the discussion is finalized. I think the simple thing, approach or goal is to be able to do a pool procurement and also to enter an arrangement that will normalize price. And also just very similar arrangement as we did for the vaccine, the pool procurement of vaccines. That has become a model that worked, and we hope that it will also work for us to get access to those drugs. I must say that the discussions with the Pfizer is more advanced in terms of the several meetings that we've had over the last series, a couple of weeks. We have a meeting set up this week with colleagues from the Merck. So as we evolve and we are close to signing an agreement with them, we'll make you that information available.
All right, thank you. Paula Depoju, good morning. Please go ahead with your question.
Yes, thank you very much for taking my question. A first question that I wanted to ask regarding an update on the Pfizer drug has been asked. And the second question has to do with the latest trend. We saw the WHO last week seeming to be fully behind booster doses. And so few days after the WHO's announcement, a research showed that individuals with cancer that even had the booster dose, they did not even have a sufficient level of protection in spite of a third dose. So I want to know, we are several years into at least several months now into the pandemic, and we've been able to see the data available has expanded. I want to know whether there are peculiar trends that member countries have reported to the Africa CDC regarding individuals with co-morbidity, specifically like cancer, and how their conditions are being put into consideration regarding vaccination guideline. Then my second question was something that Dr. Tedros mentioned in his speech during the opening of the executive board meeting of the Africa CDC. He glossed over it, but I think I would like a comment from you. You mentioned that Rwanda has already submitted documentation for its eradication of hepatitis B and C, while Egypt is also on its way towards eradicating these two diseases. So I would like to know, I would like a comment from you, and what do you think this trend from these two countries mean for the eradication of hepatitis in Africa, and the prioritization that African countries that also want to eradicate these diseases should focus on? Thank you very much.
Thank you, Paul. I think let's just be sure that we understand that our vaccination programs started very late on the continent. So collecting appropriate data from across the country that is representative will take time, for sure. There are two countries that are vaccinating very quickly, like Morocco and South Africa, that will potentially offer us a source of that kind of information so that we can have the depth and breadth of information to analyze and come out with the appropriate conclusions. But for now, I think it is my view is that it's still very early to pull data and make a comprehensive analysis of what who has received a vaccine, which comorbidities they had, and if they influence the response. What we are seeing overall, and this is based on data from South Africa, Paul, is that for the Johnson & Johnson vaccine, it provides an effectiveness up to about 5 months to 6 months. I think that is very good. And we also have seen data from South Africa that with a booster shot there, booster meaning that, remember, Johnson & Johnson is one shot, that if you take the second shot there, it actually provides effectiveness, sufficient effectiveness against the Omicron. So that is all very good. And this is all data that is about to be published or is probably now published. I've seen the preprints of that data there. So based on it, we also know that the RNA vaccines decayed about 4 months to 5 months later. So somehow it would suggest that around the time period of the 5 month mark, it is appropriate to think of taking your second shot. So that, call it a booster meaning the third dose, or a second dose, that will be the case for Johnson & Johnson. That average time period seems to be working well for those categories of vaccines. For the inactivated vaccines, we know that they do not really do well in the face of the Omicron. But we also know that if boosted with a non-activated vaccine, then they provide sufficient immune response. So then that can also be an algorithm to look at. But for the comorbidity piece, early days, in my view, is to actually pick a country other than South Africa, Morocco, and maybe Seychelles and Mauritius that have a scale of vaccinations very early on. It will be very difficult to have that kind of information for now, but it will come. In terms of the eradication, congratulations to both countries. That is what we believe in. We hope that other countries will learn from that. We also hope that it will become a teaching platform on how to do that. Once those countries that you indicated have submitted their report and they are clearly certified that they have eliminated the disease. I don't know if they use the word elimination or eradication, but at any rate, it is a very positive outcome that must be recognized, and actually congratulate those countries for their advancement. Egypt has been a leader in the hepatitis work for long. They produce drugs against hepatitis C. The president, Sisi, has been very strong on pushing the hepatitis agenda. So I think I'm not surprised that they're achieving that level of success so far.
All right, thank you. Hello to Rhoda Odiambo, who is with the BBC. Rhoda says, has any African country reported the sub-variant of Omicron that is named stealth Omicron? And if yes, which countries are these? That's the first part. The second part, in terms of sequencing, do African countries have the capacity to detect this substrain? She adds that UK scientists say that this variant lacks a feature that allows probable cases to be distinguished among positive PCR tests. Finally, she asks, should we be worried?
I think the answer to that question clearly is that we just don't have that information yet across the continent. And it's not because we don't have the capacity. We have a very strong network of what we call in the Africa CDC pathogen genomic network that has allowed us to function collectively as a continent. And that network is full of very capable labs across the network, including specialized labs in South Africa, in Nigeria, in Senegal, regional labs in Morocco. And again, it's an impressive network. So, and they are extremely experienced now in this, the ability to sequence and detect variants. So we will be looking at the database very carefully. And again, let's just remind ourselves that it's not because a variant is reported that that variant occurred at that time point. I mean, Omicron will be a good example where we all talked about Omicron from South Africa, but we also know that data from other countries suggests that, including the Netherlands and the United States, that the variant was there even before the South Africans reported it. So detecting a variant doesn't mean that that variant started from that country. And it could have been in the database. So the first order of business is always to go back to the existing database, analyze it, and see if that variant has already been in the mix for a while. So the second part of the question with respect to will the variant be picked up? I mean, let's cross that bridge when we get there. We don't be speculative at this point. Let's see what, if first of all, the variant is available, and also learn from those who have picked the variant in the UK to see the laboratory data if the variants are being missed by the standard test.
Thank you, John. We have 5 or 6 questions that are coming through as secondary questions that have been asked by colleagues, and I will put those forward to you. But colleagues who want to ask new questions, please go ahead and do so, and we'll give you priority if it is your first time around. So on to the follow-up questions. The first one is from Sarah Jerving, who's with DEVEX. She says, what sort of decisions on the African Medicines Agency do you expect to be made during the African Union meetings in the coming weeks?
I don't think that, as far as I know, there are any decisions that will be made. I think the African Medicine Agency has now been officially launched through a treaty. The task ahead is to get it operationalized, which is to have it hosted somewhere, recruit the staff, and start making it do what it's supposed to do. I don't think the head of states or the executive council or foreign ministers will be issuing additional decisions there. The AMA, as it's known, is a very welcome initiative. It will complement the work of Africa CDC tremendously. I think it's all part of the Agenda 63. If you look carefully into that agenda, it talks about developing institutions. And the African Union has already set up the Africa CDC, is now setting up the African Medicine Agency. So I don't think there's a decision that will be made in the coming days. But I might not be privileged to the details of that because the AMA, as is known, is not part of Africa CDC. It could be that it's very possible that some other discussions are happening that I'm not privileged to.
All right, thank you. The second question that we have coming through from Agostino Leita, who is with Lusa News Agency in Lisbon. He says, Africa CDC said 2 weeks ago that Guinea-Bissau was one of 7 or 8 countries experiencing the 5th wave of COVID-19. But the Guinean authorities say it is the 4th. Is Dr. John in a position to clarify on this?
I'm not, if we have had this question earlier, we probably would look more into our data and compare that with what, and do the analysis, compare that with what the Guinea is reporting. I think let it be known that Africa CDC doesn't, Africa CDC rely on countries to provide the data. Okay, that is reporting data from countries. We do not.
We're coming out of that Africa CDC report for the week. Dr. John Gengasong talking about a 5% decrease over the last few weeks across the continent of infections.